My name is Casey Etlow. I'm a senior at VCU, majoring in exercise science. And today my presentation will be talking about autonomic dysregulation related to concussion patients. So what exactly is the autonomic nervous system? It's basically the part of your nervous system that just happens normally. You don't really think about it. There are reflex actions relating to junctions between your subconscious and conscious thoughts. So any activity that goes on in the course of your day that your body normally does, and you're not physically and actively thinking about it, that is your autonomic function. So when a patient suffers from a concussion, it damages the autonomic nervous system nerves, and it affects the person's quality of life. Some facts are concussions are a mild form of traumatic brain injury, a TBI, which is caused by a bump, a jolt, or a blow to the head. The most common sports that are causes of concussions would be hockey, basketball, football, and rugby. Some symptoms, patients can experience one or more of these symptoms. They can develop immediately or one at a time. They can either be very subtle or hard to be recognized. Physical activity can worsen the symptoms. So if the patient is experiencing one of these symptoms and they could just, continue with going on with their day, it can actually worsen, and that can be very bad for the individual. What affects the patient's recovery? If it's a young person, will the student or athlete continue to be able to be in school activities, PE classes, work, schoolwork? When the patient hurts themselves, will there be a medical professional at the scene of the action, so it will actually benefit the patient so they can get treated more quicker? And you don't have to be unconscious to have a concussion, but when you are, the situation can be definitely more severe. And some of the things that affects the autonomic nervous system would be light sensitivity, dizziness, blood pressure. It can either be spiked or it can go down. You just want to keep an eye on it depending on when they're doing the exercises. The physical therapy aspect, when the patient comes in, they can do the bulky test, and that can definitely evaluate the patient if they're able to be cleared or not. This is a protocol test where every minute you will increase the increment of the treadmill, and every 2 minutes you will take the heart rate, the RPE, and also ask the patient if they're experiencing any concussion symptoms, irritability, dizziness, if they're feeling nauseous, and if by any chance the patient is feeling any of those symptoms, then you of course would terminate the test. But if they are not, then they are able to be cleared and to continue with their sports that they were doing. Any questions or comments?